Hello, everyone. Yes, today we have a special guest with us. Her name is Dr. Toni Lyn Gonzalez. She is currently working at a Texas Health Harris Methodist Hospital at Fort Worth. She's currently a coordinator and acute care physical therapist. Well, thank you, Dr. Gonzalez, for joining us today.
Hello, thank you for having me.
So let's start by introducing yourself and giving us an overview of your current role within this department.
Yeah, so I am currently a acute care coordinator at Texas Health Harris Methodist Hospital in Fort Worth. And what that entails is two roles. I still am a frontline clinician, so I have responsibilities to treat patients. And I am also a leader in the department. And my main goal is to coordinate care to ensure that patients are seen appropriately and receiving the services from a physical therapist while they are admitted to the hospital.
All right, fascinating. Thank you so much for the answer. Now, since acute care physical therapy isn't a common practice in hospitals in South Korea, could you provide some insights into acute care in general, specifically how patients are referred, how are they treated, and what roles do physical therapists play in that setting?
Yeah, in the acute care setting in the United States, it really is a fast-moving environment. Patients are coming in for something that's requiring immediate services, whether it's to manage their blood pressure, or they had a stroke, or some sort of traumatic event like a car accident. Once those immediate needs are met, then they no longer need acute care services in the hospital because they don't need 24/7 monitoring by a physician. At that point, they are required to leave the hospital. And that's really what physical therapy plays a role in, is helping these patients discharge from the hospital to the appropriate setting, whether that be to home or a subacute placement like a skilled nursing facility or an inpatient rehab facility. The hospitals have a goal to have a very short length of stay because the way our healthcare system is organized. We want these patients to discharge timely, because if they do not discharge timely, the amount of reimbursement in a way is decreased. Our system is based off of diagnostic related groups. So based off of the patient's reason for admission and comorbidities, you're going to receive just kind of a standard amount of money. And if you can get them out faster, you get to retain some. And if it takes longer, well, then you might actually kind of have a little bit of a loss. And so
Uh,
there's a lot of motivation from our administration to
mhm.
decrease that length of stay. And that's where, again, us therapists come in play to help discharge these patients as quickly as possible, but safely as possible.
Well, having said that, acute care is what you just told me. What are there any difference between acute care and acute rehabilitation as far as length of stay, or is there any like differences in, treating our patients?
So what you'll end up hearing is these terms are used interchangeably, but they're actually very different terms.
Hmm.
We use the term acute care or inpatient to refer to a patient admitted to a hospital.
Okay.
Whenever a patient is ready to leave, they can go to several levels of care. And then at that term, you'll hear the term inpatient rehab. In the United States, a patient is required to participate in 3 hours of therapy a day in an inpatient rehab facility. These are actual hospitals that undergo very similar requirements and certifications like an actual big hospital you'd imagine, because they still have 24/7 physician care, along with nursing and pharmacy, respiratory, just the whole works. And the main focus, though, of those facilities is to rehabilitate these patients to get them back to the home setting. Those are very short length of stays, and in the United States, that actually usually is a facility that is outside the main hospital they were in. So in my current hospital, we do not have an inpatient rehab wing, where patients would then go into a more aggressive receiving therapy services.
All right. So I guess acute rehabilitation is an inpatient rehab of itself, right? Or did I
Yeah, and I
understand
think
it
again,
correctly?
they're just yeah. So in acute care, and when they're admitted to the hospital for their initial injury or reason being admitted, those are going to be very limited time sessions.
Right.
Really, and the way we bill in the United States is by minutes, and you
Hmm.
have to provide at least 8 minutes of therapy, direct patient services, to charge what we call a unit. And once you charge one of those procedures, the time clicks and or the time starts. And so every 15 minutes after that, you can charge another procedure. You have the ability to decide how many minutes a patient receives based off of their needs. And so say a patient really just needs some stair training, you can get that done in about 10 to 15 minutes.
Hmm.
Or somebody needs some neuro reeducation, well, you're really going to probably spend a good 25 to 30 minutes with that patient because they need that extra time. And so that time is very variable in the acute care setting. When you get into inpatient rehab, it's a lot more structured.
Hmm.
And the law does require that the patient receives 3 hours of therapy from either from a combination of PT, OT, and speech therapy.
Hmm.
And that again is just to make sure that they're working at that high standard of care. So they're just
Gotcha.
two different approaches. One is to get them out of the hospital setting quickly, and the
Uh-huh.
other one is to rehabilitate them to go home safely with whatever resources they need.
That's very interesting to note. Now, I was also introducing you as a clinical wound care specialist. In your role as a wound care physical therapist, what specific responsibilities do you have in the treatment and management of the patients with wounds?
Yeah, wound management is definitely a specialty within our profession. The APTA here in the States really only created a pathway to have that board certification in the last few years. And I think we just had our second class of wound management clinical specialists kind of come about just in the last months or so. And if you think about a wound, regardless of its mechanism of injury, it follows a clear way of what's supposed to happen, right? You get that inflammatory response,
Hmm.
and then you get more of like what's supposed to happen next is just that healing response, and then the layer of the epithelial tissue matures. If during that process something just doesn't go as planned, then
Hmm.
it needs some intervention, some advanced modalities, advanced dressings. What a wound specialist does is they understand all those process, and they use different tools in their toolbox to really give that wound a chance to heal. And
Hmm.
here in the States, our scope of practice allows us to use ultrasound machines, um, sharp debridements,
Hmm.
place wound vacs. So we get to do a lot of that, as well as determine what is the best advanced wound dressing as well. And we work very closely with physicians and wound care nurses. I think one thing I did forget to mention is that we, in the hospital setting, it is physician run, right? I cannot just go to a patient's room and offer them therapy services.
Hmm.
So I do need an order, a referral from a provider in order to do that as well.
All right. Thank you for sharing that insight. Now, what steps or additional training did you undergo to become a specialized wound care physical therapist?
Yeah, my journey is a little different from most in terms that I was a physical therapy technician for several years between
Mm.
my undergrad and my grad years. And I was very fortunate to work at a facility that had several wound therapists and who really were specializing in that.
Mhm.
They were working at a time that we actually didn't have the certification. So they
Okay.
were just kind of doing their own research and really working at the top of the license with the license provided. And I got a lot of great training from them on just understanding how wounds mature and how to provide care when things just don't go like they're supposed to.
Mhm.
And then now that our profession allows, you can actually sit for a test and are able to demonstrate your skill set by writing a case study. So I had a patient wrote a case study about their care, and really they looking for a full picture, like looking at it beyond just the wound, but looking at it at the patient level of everything that goes into how does this patient heal. And then from there, I took sat for a test, very stressful test,
Right.
but fortunately was able to pass, and will retain my specialization for 10 years before I have to renew.
Okay. That's very impressive that you did all that on top of your clinical role and as a coordinator. So appreciate what you do for the patient population and also for your profession. Now, drawing from your experience, what advice would you offer to new grads or early career physical therapists who aspire to become a specialist or even take on a little leadership role like yours?
I think mentorship and surrounding yourself with people with just a variety of experience. I think that's what makes the hospital setting fantastic for new grads. And it's because usually there's more than one. Our facility where I currently work is very unique in that we have 60 physical therapists on staff.
Wow.
And we have just a lot of diversity in experience from people who come just from the acute care setting or people who come from an inpatient rehab setting or an outpatient setting, and then people who specialize within there, some people who specialize in vestibular therapy or geriatric therapy. All of those people are just the toolbox of all toolboxes. You can really just pick their brains, give them a scenario, and they'll help you make that decision. I think the best thing is ask questions.
Hmm.
Nobody can help an individual if they don't ask questions, because
Hmm.
unfortunately the assumption is that they're doing great. It's very
Sure.
easy as a therapist to kind of stay under the radar.
Hmm.
But yes, ask questions when needed. Find a facility that will offer just experienced staff to mentor you. And it
Hmm.
doesn't have to be a formal mentorship. It just has to be someone who's available there to help pick their brains. And what would you do scenario.
Hmm.
And I think if someone wants to become any of the specialties that our profession allows, it's really become a generalist first,
Hmm.
understand the different areas that we can work in.
Hmm.
And then after, you really have that under your belt a year or two in, then you can really start to specialize, but really understand multiple aspects of our profession before going into one.
Gotcha. Um, would you want to add on to the leadership roles? Let's say if they
Oh,
want
yeah.
to attain a
I
leadership.
I think what's interesting for our profession is that we're all frontline clinicians at one
Hmm.
point. And so you look at how leaders develop, and it's maybe we all had this little bit of a desire. We had these leadership roles and just kind of came up by opportunity.
Okay.
Um, I think a frontline clinician who's really good doesn't equate to a really good leader and vice versa.
Hmm.
And so if somebody wants to become a leader, it's really look for small opportunities where you're leading a very small group, like a representing your department at a meeting, or finding a way to take the lead on a difficult case, and then you're
Hmm.
kind of leading that care team. So that's kind of going clinically. And
Hmm.
then when opportunities arise to look at taking a course
Hmm.
or continue to read different books,
Hmm.
you never know when you've read a book and you're like, oh, that is actually a really good idea, how to solve this current issue I have. So it's really expand your horizon. You can always learn. There is no reason your point is always right, and we all have blind spots.
Hmm.
So be open to that criticism of your blind spots, so that
Hmm.
that will actually make you a very better leader if you allow that feedback, and because you have to give feedback as well.
Gotcha. Well, thank you for covering such a vast amount of topics in a short period of time. Before we wrap up, would you be open to sharing your contact information for viewers or audiences who may have more questions for you?
Yeah, I'm open to that. Best way
Hmm.
to reach me will be by my work email,
Hmm.
and I definitely might be able to give you my card, and I'll get you a screenshot of that so you can have that available to pass along.
Gotcha. Thank you very much. I'll take note of that and also share it to our audiences later on. Fantastic. Thank you so much once again, Dr. Gonzalez, for joining us for the interview.
Yes, thank you for having me.